There are hospitals that promise specialized treatment for the worst kind of heart attacks. They keep teams on call 24/7 to save lives, which is why it's odd the Swedish Medical Center decided to just kind of take a little break from offering that life-saving care. Our Cole Sullivan asked why.
With heart attacks, cardiologists have a mantra: time is muscle.
Every single minute counts when it comes to STEMI care.
Dr. Pyle Coley says STEMIs, the worst kind of heart attack, have one superior treatment that must happen fast. Her fellow cardiologists insert a catheter and expand a bubble to unblock the artery.
And the cath lab is where these surgeries happen, where patients have their arteries opened during these potentially fatal types of heart attacks.
She says cath labs are standard at hospitals across Denver. But at Swedish Medical Center in Inglewood, the cath lab closed last weekend. The hospital confirms it had, quote, planned operational downtime scheduled.
A cath lab should not close. By definition, it is a 24/7 facility. This is sort of like saying the emergency room is closed.
A Swedish spokesperson says the hospital hasn't had any delays or diversions. Quote, we have operational downtimes and do extensive preparation, including notifying appropriate stakeholders. Stakeholders like ambulance providers. Denver Health says its paramedics know about the issue at Swedish and follow normal procedures to bring impacted patients to other hospitals instead.
It just makes me really mad, Cole, honestly.
Swedish is an accredited chest pain center with a special designation, which according to the American College of Cardiology means it has cath lab staff available 24/7 every day of the year. No listed downtime exception.
This hospital really risks losing their accreditation because of what they're doing.
But more than accreditation, she worries about patients.
You know, as a cardiologist, I'm shocked and I'm aghast that there are cath labs in my own city that are having planned downtime.
We asked Swedish many more questions, like why and how often its cath lab is closed. All the spokesperson would say is that the lab is currently open and hospitals prepare for scheduled downtime. I spoke to two different Denver hospitals today that each told me their cath labs don't have scheduled downtime. And Dr. Coley says her colleagues told her a closure like this is exceedingly rare, and you can understand why, Kyle.
Yeah, I mean, as Dr. Coley kind of likened it to with an ER, if I'm rushing to an ER, I'm not thinking I should pick up the phone and ask if they're open.
Exactly, and if you show up in these cases, as Dr. Coley says, and it's closed, you have to go to a different emergency room. And as she said, time is muscle. They want to get this procedure done as fast as possible.
Really interesting. Cole Sullivan, thank you.